Testing 1 3 1 2 3 testing. Good evening, family. My name is Robin McGrady. I'm a registered nurse. Please apologize the clothes I normally would have on my nursing uniform, but it's important to me that I get this video out, which is part 3 of a 3-part series, which started talking about Black men and their health and the multifactorial problems that are associated with Black men not receiving the proper health care. Number one, we know the historicity is clear. Negative abuse, flagrant abuse, experiments such as the Tuskegee experiment and things of that nature, healthcare disparities, which is basically racism. And also presently, these things are going on today. Not as far as the experience, as I don't know, but I will also say the healthcare disparities and the racism is alive and well. Today, I want to try to dispel some of the myths and get to the truth and talk about what the community can do, what you and I can do to get the brothers together. Number one, hypertension, diabetes, and renal failure are the top three problems that send men to a nursing home, Black men to the nursing home 35 years old. Is ugly, family. What can we do? I made a sharp pivot from talking to the women. I want to talk to I'm making a sharp pivot from talking to the men. Now I'm talking to the women. Sisters, where are my sisters at? I need y'all. I desperately need y'all to help me in this and help men get better. This is going to be a 3-step intervention. Number one, we have to create a safe place for men to feel vulnerable enough to speak. What is a safe space, Miss McGrady? I'm glad you asked. A safe space is anywhere that man feels like he is able to share what's on his heart. If this trust has been broken, then we have to reestablish communication through the power of forgiveness. In other words, if he doesn't trust you, if you do not trust him, open up the pipeline and say, hey, forgive me, I was wrong. Number two, we can create a safe space by being soft toned in our voices. You know, the Bible says a soft answer turneth away wrath. A lot of times men are angry because they hide from themselves, they hide from us, and this bottled up rage is a precursor to all types of illness. It's living in the shadows. It's the darkness that I cannot see. It's the darkness that I cannot articulate. Come on, sisters, come with me, because y'all know what I'm talking about. But I need your help. It starts with the community. It starts with the home. You know, that big, beautiful bill is not for us. It's taking us back. And we also have to be active politically in writing our congressmen, writing our senators, and speaking up and advocating for what we know is wrong. You know, if enough people get together and contact their congressmen and say, no, I don't like what's going down. I don't like the legislation that's being passed because this is not empowering our community. But if we ourselves don't respect our own bodies and take care of ourselves, then how in the world can we get somebody else to invest in our community? We need to invest in each other. A community consists of a safe place to live. A community consists of grocery stores, not a bunch of stores where there's sugar drinks and things of that nature. A community is thriving. It is bustling. It is alive. And our communities are deserts. So that said, women, I'm offering a call to action. Please contact your local congressman. Please contact your senator and let them know we do not agree with these most grievous legislative practices that are on the table, that have been passed. And ain't nobody saying nothing. I think the silence of the community is more deafening than all. You know, Martin Luther King said it wasn't the racism that dripped from George Wallace's voice, but it was the silence of the Black community that didn't come forth out of fear. We got a crisis, y'all. Black men and women are dying of the trilogy. What is the trilogy? Hypertension, cardiac disease, and strokes and dialysis. That's the fourth one. It's killing us by the droves. Unnecessary. We're talking about women now under 40 being diagnosed with hypertension. Come on, family. It's a call to action. It's a plea. It's a plea. How do you create a safe space? In your home. In your home. You can dampen the lights. You can speak softly. You can use telehealth medicine as a way. If a man does not want to go to the hospital, you can take the blood pressure, vital signs, and you can get that forwarded to a nurse practitioner. Number 3, you have patient rights. Patient rights allow you patient rights in the hospital. There's a law called a patient bill of rights. A patient bill of rights allows you to choose your health care practitioner. If you request a female, you can have a female, or you can have a male if that person is available. Know your rights, family. At the bottom, I have a link attached to the Patient Bill of Rights, also to local community access as far as health care and how to access safe spaces where men can talk and women too. Thank you for listening. My name is Robin McGrady, and have a beautiful day.